This is Ryan Kelly, Managing Editor for the Journal of Emergency Medical Services, and I'm here with Dr. Brian Clemency from the University at Buffalo in New York. And Dr. Clemency, congratulations on winning one of the EMS10 awards for 2016, one of the top innovators of the year. It's an honor to talk to you.
Thanks so much for having me.
Dr. Clemency, so you are a big advocate for limiting the use of backboards in EMS. Can you tell me a little bit about how you started out with that perspective?
Sure. As a former basic EMT, I backboarded lots and lots of people under the old spinal immobilization paradigm. This idea that if you put somebody on a backboard, all of a sudden you didn't have to worry about anything else. The back wouldn't move. You wouldn't cause any other damage. And we know that's just not true anymore. We know in some cases backboarding someone makes them move their spine even more than not doing so. It causes pain. It puts providers at risk of injury. Lots of potential downsides. It was begun many, many years ago as a practice based on little evidence. And it's the job of researchers like myself now to provide the evidence behind changing that paradigm to the new spinal motion restriction model.
And where did you collect your evidence from?
We did research out of Buffalo, New York. We primarily get our data from Erie County Medical Center, the Trauma Center, and American Medical Response, our main EMS provider in the region. And I think it's really important when you look at EMS research to not just look at what happens on the ambulance, but link to the patient's outcomes in the hospital. So by looking at what happened first in the ambulance and then tying it to the patient later on, that's how we really know if we're having an effect or not.
And can you tell us about some of the data that came out and the results that came out from the study?
In our first study, we looked at 4 years worth of data over 5,000 patients. Oh, wow. And we looked at all the patients that we placed on a backboard and asked ourselves what percentage of those had any potential to be helped. We know there's downside that everyone suffers by being backboarded, but who's the group that we're focusing on here? In that study, we found that about 0.5% of all the patients that were backboarded had an unstable fracture requiring surgical fixation. So we're talking about really, really small numbers that may or may not have a benefit, but we're backboarding large numbers that we know have no potential benefit. In our follow-up study this year that we presented just in January, we looked at what happens when we dial back spinal immobilization. And we found when we changed from a spinal immobilization protocol to a spinal motion restriction protocol, not only do we backboard many less patients, but ED physicians ordered less imaging.
Wow.
So there were less CAT scans and less x-rays ordered because less patients were backboarded. That's a real downstream effect from our protocol change.
It's huge, yeah. And did that result in any large-scale changes in the state of New York? Or?
Well, fortunately, New York State has already changed their model to spinal motion restriction. We have a new protocol that's been out for about 2 years now. In it, it says that the backboard is one of many ways to limit spinal movement. And so it allows providers to use the backboard if they choose, but not be obligated to if they don't.
Oh, wow.
It's our hope that our research will help other areas and other states or regions that have not yet come on board spinal motion restriction to change their protocols based on our data.
Well, that's pretty amazing. Amazing work, and it's great work to be helping not only our providers, but also all of the patients out there that have been injured by the improper use or the needless use of a backboard. Thank you, Dr. Clemency, and congratulations on winning one of the EMS10 awards for 2016.
Thanks so much.
This is Ryan Kelly from the Journal of Emergency Medical Services, and I'm here with Dr. Clemency, one of the EMS10 award winners for 2016.